If you are new to my channel and want to educate yourself more about herpes viruses, please like my videos and subscribe to my channel. Make sure to ring on the notification bell so that you'll be the first to watch my uploaded videos every day. Let's put an end to the herpes virus.
Genital herpes versus hemorrhoids. Many people don't realize that HSV-2 can cause lesions and other sores around the anus and inside the anal cavity. They believe that any sores they have in this area are caused by hemorrhoids or anal fissures. Sometimes symptoms can be self-misdiagnosed as heat rash, ingrown hair follicles, insect bites, jock itch, or even an allergic reaction. Hemorrhoid symptoms. The most common symptoms of hemorrhoids are itching, general rectum pain especially if any pressure is applied, and bleeding during bowel movements. External hemorrhoids are the ones that cause most rectal pain because a hard painful lump is often caused as pool clots under the skin. Internal hemorrhoids often don't cause any pain, but there is rectal bleeding after a bowel movement. Those suffering from internal hemorrhoids may notice blood on the tissue after wiping or blood on the surface of the stool. Anal herpes symptoms. The symptoms of anal herpes and hemorrhoids can be similar. Both cause a knife-like pain during bowel movements, which has been described like trying to pass glass that can last as long as 20 minutes after a bowel movement. Anal herpes can cause blood on the tissue and stool, just like hemorrhoids. The infected area usually burns, tingles, or itches. The biggest difference between hemorrhoids and anal herpes are the additional symptoms to the sores around the rectum. These often include lower back pain, headache, muscle ache, swollen lymph nodes, low-grade fever, and a steady recurrence of the symptoms. With anal herpes, there's often also a mucus discharge with the blood that's not commonly seen with hemorrhoids. Why are the two often confused? Anal herpes and hemorrhoids are often confused because patients tend to focus on one or two symptoms instead of honestly looking at all of them. If you suspect you might have anal herpes, it's important to see a doctor as soon as possible for treatment. Do not try to diagnose yourself. If you do have anal herpes, the illness isn't curable and you will have it for the rest of your life. But you will be able to control the severity of the outbreaks and possibly the frequency of them. Treatment. Since anal herpes is a viral infection, treatment is usually with antiviral medications. These types of drugs fight off the virus activity in the system and help reduce or control symptoms. Antiviral medicines also reduce the duration of the infection and the risk of the virus being passing on to a sexual partner. Doctors should treat people as soon as possible since early treatment decreases the risk of transmission to others. Examples of antiviral medicines to treat anal herpes include Famvir, Valtrex, and Zovirax.
Thank you for watching. And please subscribe to my channel for my upcoming herpes treatment videos.